Is experiencing dizziness ever a good thing? Is it always bad? Well, having dizziness or vertigo to begin with is not good. Let's take that for granted. But when you have it, should you be putting yourself in situations where you might be experiencing your dizziness or vertigo, or should you avoid it at all times? Now that's going to come down to what is causing your vertigo or what's causing your dizziness. Now I'm going to start with when you should avoid vertigo, when you shouldn't be pushing into those symptoms. We're going to start with the first one is BPPV. So this is a mechanical problem where these little crystals get loose in the inner ear, and there's a simple fix for it. You go through these couple maneuvers to reposition the crystals, feed them back around in the canal, put them back where they're supposed to be, and it's gone. There's no need for you to, what we call habituate, do the exercise over and over again. There's a simple fix for the problem. And if you need help figuring that out, you can check out my Vertigo Kickstart Mini Course, where I teach you how to figure out which specific canal is involved and give you the best maneuver for that specific canal. So BPPV, get that fixed. That's not something that you should be, re-experiencing that vertigo. The second problem, let's say cervicogenic dizziness. Now this happens often when there's these impairments in the neck or structures that are irritated in the neck, and oftentimes just turning your head is making things worse. Now, turning your head can make things worse a lot of times with dizziness, but specifically if you're experiencing cervicogenic dizziness, we want to get that neck problem fixed first so that you're not making your problem worse when you're just irritating the neck structures more. So you can have overlapping conditions, and that's when I would say, okay, first you want to treat the BPPV, then you want to treat cervicogenic dizziness, and then move on to those. Those are some of the more, kind of depends, but typically the more simple problems to fix. Now, thirdly, if you're experiencing an active migraine attack, you don't want to be doing any vestibular exercise. Your brain is not in a position where it can adapt, where it can learn, where it can, make changes. So that is not the time to be doing exercises, and vestibular migraines is one of those gray area diagnoses where at times, yes, you do want to push into your symptoms, but during an active migraine attack, you don't want to. And then other problems like perilymphatic fistula, semicircular canal dehiscence, those issues that do need surgical intervention, you don't necessarily want to be pushing into your symptoms because, that's not going to change the problem. There's a structural issue within the inner ear that needs to be fixed, not so much of a brain adaptation issue. So now when we're talking about pushing into your symptoms a little bit, this is when you don't want to necessarily avoid everything. What we call this often in physical therapy is habituation. So habituation exercises are those that you kind of repeat over and over again. You're pacing them appropriately, but you're repeating them in order to teach the brain it's okay to do that movement without getting dizzy, or it's okay to be in that situation or in that environment without getting dizzy. And you need to expose yourself to those situations within certain conditions. So the first one being 3PD, persistent postural perceptual dizziness. That's an issue where the brain is having a hard time organizing all of your sensory information. So in order to get back to normal, you got to increase the input of that sensory information to get the brain to reorganize it and process it more efficiently. So that's a diagnosis where, yes, you do want to push into your symptoms a little bit, be a little uncomfortable, but only enough to where you'd still be able to recover within a few minutes. We're not talking about like really, going an hour, making you like 8 out of 10 dizzy or more, and then you're feeling terrible for the rest of the day. These are little short spurts, like a minute of an exercise, or going into the grocery store for a little bit, and just, I'd say usually like a 2-point increase. So if you started at a 3 out of 10 with your dizziness and you go up to a 5, that's when you want to take a break, let your symptoms go back down to your baseline before you start and continue the activity. So 3PD, another diagnosis that you want to expose yourself to things that make you dizzy is a vestibular neuritis. So if you have a weakness in the inner ear, typically caused from a viral infection, causing that nerve to not send signals as efficiently as it used to, the brain has to compensate for that. So we want to expose the brain 2 more of situations that make it dizzy so that it can correct. Now, the brain only makes adjustments, only corrects for things, and changes when you introduce an error. So if you're turning your head quickly and things are getting dizzy, then the brain's saying, hey, I need to correct for that. I need to make a change, and I need to process this information more efficiently so that you're not dizzy. So in that situation, you do want to expose yourself to some activities that do make you dizzy. Now, the other conditions that you may want to expose yourself to dizziness is maybe after you've treated BPPV, the spinning's resolved, but you're just kind of getting this wooziness with rolling over or sitting up in bed. So if the quality of your symptoms have changed, it may be of more of a motion sensitivity, and the more you repeat that movement, the less symptoms you should have. So it's going to depend on what is causing your vertigo, on whether or not you should pursue kind of pushing into those symptoms, into that vertigo, or if you should avoid it as much as you're able to. Because some of those conditions, one are either an easy fix, need surgical fix, or it's not a factor of the brain needs to adapt. So if it's a situation in which the brain needs to adapt to compensate for the problem, that's when you want to expose yourself to exercises that that may make you dizzy, to get that brain to adapt, to get those neuroplastic changes. So if you're trying to figure out what's causing your dizziness, you can check out my free ebook on the 5 most common causes of dizziness and how to recover. I go through kind of the key symptoms of each diagnosis. That'll help you figure it out. Now, if you do have overlapping conditions, as I said earlier, make sure that you fix that, the easiest fixes first. So BPPV, get that out of the way. Cervicogenic dizziness, work on that neck, whether you need more mobility and whether you need more stability, whether you need to decrease the inflammation and the irritation in the neck. And then once you fix those problems, that's when you can move on to addressing those other conditions if you do have more than one overlapping. So if you have cervicogenic dizziness with BPPV and vestibular neuritis, you fix the BPPV first, then you move on to working on the neck, and then you move on to addressing the vestibular neuritis. And the reason that I kind of brought up those ones is because a lot of times the times when viewing exercise, or what we call gaze stabilization, is an exercise that we give for vestibular neuritis when you have a weakness in the inner ear. And it's an excellent exercise that we have a lot of research behind, that you improve with that reflex between the inner ear and the eyes when you do it frequently and often. But if you have a neck problem, moving the head left and right, that's just going to continue. That's just going to make your symptoms worse. And so if we can reduce that cervicogenic dizziness, you're going to have more success in moving on through that vestibular neuritis. I hope this was helpful for you. Thank you for watching, and please leave a question in the comments if you have any.